went from podcast to broadcast. The Home Healthcare Today show is back. I'm your host, Dr. Cleamon Moorer. The show is sponsored by Meridian Health Plan in Michigan. Stay tuned.
Making every promise complete.
Welcome to season 1 of the Home Healthcare Today show. I am your host, Dr. Cleamon Moorer. Good afternoon, and welcome to the very first installment of our podcast titled Home Healthcare Today.
Let's take a sec to think back. Bringing back in the day. Take a sec to think back like this. Go inside your mind and find a time that you miss. Let's take a sec to think back. Bringing back in the day. Take a sec to think back like this. Go inside your mind and find a time that you miss. Let's take a sec to think back.
Would you recommend in-home physical therapy and occupational therapy and perhaps even skilled nursing for clients who are recovering from COVID-19?
Definitely. I feel that anything that a person can do to move towards their baseline is important. No matter what a person is dealing with health-wise, if it's something that they have not experienced before and they don't want it to become a permanent part of their life, they have a right to fight against that.
Absolutely.
And there are trained professionals that have tried and true and measured interventions that have helped people from very difficult situations.
Absolutely.
And especially if you're dealing with things like feeling fatigued and you just don't have the stamina, or some people have like neuropathy, which is a nerve pain that results from it, working with situations like that. Just feeling that you're not able to take care of your health care needs because you don't have the energy, or you might be having some residual problems with shortness of breath,
Yes.
with heart, with chest pain, things of that nature. And that can be a scary place to be in, having a trained professional at your side to not only help you to stay adherent to your treatment plan, not only adherent to the recommendations, but be a liaison for you between your medical provider and what you're experiencing in the home, give you that extra added support.
So when I operate on someone's heart and we put a stent in, it's not over. The patient has to take medications, they have to engage in cardiac rehab. If patients have cardiac surgery, heart surgery,
Yes.
they may be in the hospital for 3 to 4 days, but when they go home, they have to be able to ambulate, they have to be able to work with an essential spirometer, to take deep breaths, have breathing exercises. So it doesn't stop, the treatment doesn't stop when you leave the hospital. And that's why it's so important, at least in the home healthcare sector, that you have dedicated healthcare professionals who are gonna come into your home, who are trusted, who are gonna help you recover and heal.
We know that the support that helps keep people in their homes, helps keep people out of the hospital, is tremendously important. These home health services, even can help people stay healthy within their home, manage their condition, give them the assistance they need, give their family the assistance they need, who are often working and pulled in a lot of directions and bringing in some extra assistance can be tremendously helpful.
So, Doctor, how would you suggest encouraging minority patients and populations to consider home health care as an option as part of that multimodal approach to healthcare and wellness?
Certainly, and I think once education is factored into this, and cultural competence, and an understanding of, hey, you're from, this is a patient that's from, East Detroit, where our clinic is. Hey, we understand this patient, and they're going to feel more comfortable, speaking to us as a result. I think the other thing is providing excellent services. So one of the things that we pride ourselves on is trying to deliver state-of-the-art care, and regardless of the expense, to our patients. Just as an example, so as a sports medicine physician, I specialize in ultrasound guided procedures. We purchase ultrasound units and we deliver point of care ultrasound right when patients come into our clinics. And so I think providing an excellent product, a product that is culturally competent, I think the rest naturally will follow.
That's it.
And so I love the way that you really kind of broke it down to, why should we trust you? I think ultimately it comes to a question of why should we trust you? Absolutely. And I think it's about building that trust. And it starts with cultural competence.
100%. And I want to elaborate on this because I think this is so important, is especially here in the city of Detroit, not just the city of Detroit, but elsewhere, communities can really benefit from what I call the home-based model. And I'm very, very proud to say that when I first started with the health department, one of the first program I actually worked with Dr. Moorer was the Childhood Lead Poisoning and Prevention Program. Wonderful program at the health department. And I got to give another shout out to the folks that are still doing that hard work. They're a small team, but they are some of the hardest working group of women that I know. And I just want to say that. And so in this experience, I got to go to patients' homes and see the home environment, see the community environment, and I saw firsthand, Dr. Moore, the benefit of meeting the patients and families where they're at, not where we're at,
but where they're at.
Yes, sir. And so when we did that, the amount of support and feedback that we got back from our patients, the kids that we serve and their families, was nothing but positive.
Home care is critically important because people want to stay home.
True.
They want to stay in something they're comfortable in. It's very hard if somebody has to go to assisted living or something, then you've got to move some furniture in like that.
True.
But if somebody can stay home as long as possible, it reduces the problems that will come when more and more people need assisted living. But if you can make the house usable, so one of the first things you do is get somebody to come in and say, who's going to trip where?
Right. The fall and safety assessment.
My parents had rugs everywhere. They had things all over the floor. And just having somebody to come in first in terms of OTPT and make the house a little bit safer.
Absolutely.
If you're using a walker, having bumps in your road is going to be really difficult.
Absolutely.
So how can we reduce hip fracture? How can we reduce leg fracture? One of the ways to do it is to check your home.
As an industry association, that we help agencies rise to the top. Organizations like yours who are doing extra things in order to develop trust and to develop the policies and procedures that can essentially give assurance to the patients and their families that the care you're giving them is the best.
Indeed.
And that you're able to do that in a way that they have confidence.
Yes, sir.
That the people providing that care know what they're doing and have compassion and skills necessary in order to be effective and to do the best job possible.
Home Healthcare Today show is sponsored by Meridian Health Plan in Michigan. Meridian Health Plan in Michigan is Michigan's largest Medicaid HMO, providing care to over 500,000 Michigan residents. Meridian also offers products and services to the senior community. Their WellCare program is another HMO that provides care. But our program, the Home Healthcare Today show, brings content to households all throughout the Southeast Michigan area and beyond by following the Home Healthcare Today show on YouTube. We have content and topics for all realms and walks of life, from pediatric care to maternal health to adolescent care, mental health topics and the like, all around health and wellness you'll find on the Home Healthcare Today show. Watch us every Saturday morning, 10 a.m.
Never in the history of healthcare delivery has an organization offered such complete care to Detroiters. Your eye care experience may begin in our state-of-the-art eye clinic, but it doesn't stop there. We can come to you. Delivering vision and home health care is the hallmark of the Eye Care for Detroit and American Advantage partnership. Helping you to feel better and see clearly is the perfect putt. Call Eye Care for Detroit today.
Welcome back to the Home Healthcare Today show. Yeah, we started our premiere episode last week where Meridian Health Plan in Michigan, they were focused as our sponsor. New show, new year, new you. But in this episode, we had to go back to our roots. The Home Healthcare Today show started as a podcast in 2021. Our goal back then was to make sure that we inspired, informed, and engaged listeners and viewers over a litany of healthcare topics. We're back. Our mission is greater and is stronger. We have gone from podcast to broadcast. It's only right that I bring back the inaugural guest of the podcast from 5 years ago to our television broadcast, Dr. Deirdre Claiborue. Welcome back to the Home Healthcare Today show.
So happy to be back.
Doc, for those of you who do not know who Dr. Claiborue is, Dr. Claiborue is a family medicine physician with over 25 years of experience in the medical field.
Not supposed to tell that part.
Oh, but yeah, how did she get 25 years and she like 30? So you can go to medical school at 5. All right, young people. Doc graduated from Wayne State. Yep. She is the medical director of American Advantage Home Care, provider lead for Crossover Health, and a board member of Eye Care for Detroit. Doc, welcome back. This is a full circle moment.
Yes, it is.
So, Doc, oh man, I think we were in the throes of the pandemic back in 2021.
Yes, we were.
You helped launch the very first episode of the podcast. You were providing education, medical education to our nurses and our clinical staff through American Advantage Home Care. Now we're on television. Hey,
Yes.
Doc, what does this full circle moment mean to you, Doc?
Well, it just represents growth and opportunity.
Yeah.
You know, that's what it's really all about. It just means we've had a chance to touch more people in the professional sphere, in the community, get the word out,
Yes.
you know, become more visible.
That's right.
And all of those things, you know, increase accessibility, and, you know, that's something to really be proud of.
It is, Dr. Claiborue, and healthy living is a lifestyle. So we are a lifestyle and wellness show. Even though we cater to the homebound community, we want to bring health and wellness into homes on a weekly basis, you know. Now, you wear many hats, Doc. So that provider lead, you know, crossover, the work that you do with us at American Advantage, and even your board role in Eye Care for Detroit. How do you continue to connect your own personal mission to all these missions and values of the organizations you serve?
Well, I feel that, you know, when you put yourself out there and look for opportunities, you can come across like-minded people.
Yes.
You definitely can't come across them in a silo or in a shell. You have to actually engage. And I feel that, you know, when you get a group of like-minded people together, that's the spark. that lights the flame.
Definitely.
Because you have to, no matter how great your vision is, it's much greater and much more possible when you're doing it in a collaborative and cooperative way.
Absolutely.
So I feel that, just gives you that opportunity to touch more people, meet more people, learn from people, not only bringing something to the table, but you're also gaining something. It's an opportunity for you as an individual to grow.
Absolutely, Doc. So you make me think about that. 52 episodes coming up here in 2026 of the Home Healthcare Today show. So every Saturday morning, 10 o'clock. That's about, I want to say, almost 104 guests.
Yes.
In the event that we're doing 2 guests an episode, a max of 104. So to your point, you meet so many people when you keep your feet moving. And you're able to engage, viewers and listeners with so many experts.
Yes.
Speaking of which, in terms of expertise, home health care. We're American Advantage, of course, American Advantage. But outside of just our agency, American Advantage, what have you seen in the evolution of home health care?
Well, I feel that, there's been a realization that you have to personalize it.
Yeah.
It's not like one size fits all.
Not at all.
You really have to get to know the people you're taking care of and their families, build that trust.
Yes.
And also, try to do some things that might be unique to that particular person.
Yeah.
Because you want that person to feel seen and heard. That's really important. And, people are really getting more comfortable with advocating for themselves.
Yeah, absolutely.
Speaking up, saying what works for them and what doesn't work. The question is, being able to actually pay attention to what they're telling you and to put those things into action.
Yep. You want to definitely have that listening ear, right? And to that point, right? So folks get discharged from hospitals. They're in and out in some cases. There's people that see their primary care physician every once in a while as opposed to the checkups and the like. And some families have experienced some problems with the system. At American Advantage, we try to close the gap. We built I Care for Detroit, literally I Care, or We Care for Detroiters. We built the mobile optometry and the clinics and brought in ophthalmology to try to close those gaps for folks. But Dr. Claiborue, being a veteran of the system, of systems, plural, where do systems in healthcare sort of go wrong, and where can we help close those gaps and advise families on what to do right in view of healthcare?
Well, I think where they've gone wrong is that they've kind of depersonalized healthcare. At the end of the day, you're still working with that one person in that one moment, and sometimes you only get that one opportunity to build that bond because first impressions count.
Yes.
So I feel that sometimes, volume comes before quality.
True.
And that definitely when it comes to health, that's not one of the things that you can just package up in a neat box all the time.
Cannot, no.
You have to look at the broader picture, look at what your goals are, look at what outcomes you are expecting and how you can meet those goals. And, it's not like sometimes you get a do-over. Sometimes with some other things, you're cooking, you mess up the recipe to the cake. You can do it. You can have a do-over and try to make that cake again.
Yes.
But when it comes to people and their health care, sometimes that doesn't work. So you have to really pay attention to detail. You have to be focused. You have to know what your mission is, and you can't stray from that for anyone or for anything. It's just like having that area where you kind of draw your line in the sand and you're not going to cross that line. I think that's very important for any organization.
Absolutely, Doc. It truly is. And just a stat out there, 9 out of 10 seniors surveyed say that they want to age in place, right? They want to be at home. So to your point of not having a personalized care plan, care providers not providing that bedside manner, or in our case, curbside manner in terms of a mobile eye care unit, it's a strain. It definitely places a strain on the system, right? Hospital readmissions in some cases where we want our patients and we want the community to be compliant, right? But at the very same time, we have to sort of mitigate some of those hurdles that prevent compliance. So, Doc, a wild card there. What are some of those challenges that you see? Speaking of social determinants of health and some other challenges that sometimes makes it a little difficult to be compliant whenever you think about patients, you know?
Yeah, that's a great question. There are so many challenges.
Yep.
I mean, just the fact that you're bringing the mobile unit to people's homes in the community, that mitigates a huge challenge with transportation.
Yes.
And also, in terms of people being non-compliant / non-adherent, sometimes it's a lack of understanding because no one has actually explained to them why they're asking them to follow a certain regimen or a certain protocol or take a certain medication. And people can be a little reluctant to do things that they don't understand. So it's like not using that time or having that time to fully explain. And, you know, there are ways around that. You can use if the doctor doesn't have time, the nurse can step in. If the nurse is busy, someone else can step in. If you use that team approach and you rely on each other and you're all saying the same thing, I think that makes a difference. But, you know, asking a person why they're not following the recommendation, I think that's the first question, as opposed to say you're not following the recommendation. You need to understand why.
Yes. What are those hindrances and what are those challenges? And to your point, as a team, how can we hit and block? How can we mitigate those challenges? Great for our show sponsor, Meridian Health Plan in Michigan. Meridian, as a provider of health insurance, is dedicated and committed to helping not only its members, but the general public throughout the community to mitigate and try to mitigate and fight against those factors. Dr. Claiborue, when is the right time for home health? You know, we know, like, hey, I got a medical emergency, I'm going to the ER, right? I got a bruise because I fell. Hey, I'm going to urgent care. Or it's just my weekly checkup and, you know, my annual checkup. I'm going to my primary care physician. But when's the right time to call American Advantage?
Well, I think that, you know, it really depends on what you're dealing with. Now, some people, they're doing well in their home, and then they have something that happens out of the clear blue sky. It's episodic. They might have a fall because they tripped over something, not because they're unstable on their feet. That person will find themselves in the hospital, and from the hospital transitioning back to their home. So they may need home care for a short period of time. But there are other people where their family members actually notice that they're not able to perform those activities of daily living. They might be forgetful. They might not be taking their medication daily. They may be unable to prepare a nutritious meal. All of these things are cues. And actually, when you deal with them sooner as opposed to later, you're actually preventing the one big fear people have. Because they think that home care sometimes is associated with a segue into nursing home care. And actually, home care that is instituted strategically and at the right time is a prevention from going to nursing home care. It's an opportunity to stay in the home longer because those services that are needed are attended to, and it gives the family members that sense of security that your needs are met. And so having that extra hand in the home can be so useful because we've had it all along, but we just didn't call it home care. We call it Aunt Sally, Uncle John.
That's right.
We called it, you know, the cousin, the neighbor. And that's when we were living, you know, more communally. And we were in touch with our neighbors, and families sometimes lived side by side. But our society has changed, and we're not able to necessarily depend on that neighbor. Or that daughter or son may be working for a longer period of time, than they have in the past to make ends meet, and
Amen.
they're not able to take up the slack.
That's right.
So having that other trained community partner, such
Yes.
as a reputable and dependable and compassionate home care agency, that can be your partner.
Absolutely. Hey, you all heard it here on the Home Healthcare Today show. If it's that time or that time is nearing for you or a loved one to reach out for home health care services, trust American Advantage Home Care. You can visit us at AmericanAdvantageHHC.com, or you can give us a call at 313-914-2296. Dr. Claiborue, it's always a pleasure, right? This full circle episode. Thank you so much for joining us and sharing so many valuable insights
Well, I
with
appreciate it.
viewers and listeners.
Thank you.
All right, folks, stay tuned for next week of the Home Healthcare Today show. Our topic of discussion next week is healthy weight loss. So, timely for a new year. Tune in next week to learn about healthy weight. Many of our viewers are caring for their aging loved ones, and then they put themselves last. What's your advice to the caregiver who says, I just don't have time. I just don't have time to focus on my own health? Yeah.
Well, you know, it's interesting. I said this to someone actually yesterday. We were talking about vessels, and we were talking about from a spiritual, like a scripture as it relates to vessels. And one of the things that I was saying is that you cannot fill other people's vessels from an empty vessel.
There we go. Yeah,
You know,
absolutely.
and so you really have a responsibility to take care of yourself so that you can care for others.
Yes.
Because truly, if you are empty, if you are unhealthy, you know, how can you fill someone else's vessel, and how can you support someone when you're at a weakened state?
Difficult, very difficult to do.
Yeah, very
Absolutely.
difficult. Yeah, yeah. And I do understand that for many people it can be challenging. It can seem overwhelming to make significant lifestyle changes. But if you have the mindset when you wake up in the morning that I want to be a healthier version of myself today, and you look for ways to be healthier, to eat healthier, to move more, over time you'll become a healthier version of yourself.
Bringing eye care to your home. Healthcare that won't leave you alone. A promise kept, a vow so true. Now my eyes are on you. My eyes are on you. My eyes